I would hope that I'm the type of person and provider who could say, hey, you know what? I don't have a dog in this fight in the sense of like, I have to be right. I just want to do right by my patients. I don't want to tell people things that just are blatantly not true, or stand firm in the ground of like, well, I'm not gonna budge on this, even though it hurts my feelings or whatever. Like, that's silly, guys. It's so silly. Hey guys, Nico here with the Nico Misleh podcast. Great to be with you as always. I got a topic I want to share with you today that's near and dear to my heart, and that is this idea of being wrong. It's okay to be wrong. And what does that mean? So let me unpack this a little bit. For the longest time, I was told via a lot of my own mentors growing in the HRT space that, progesterone was like not for guys, like 0%, never ever going to happen. Don't ever give it to dudes. And there was some logic behind that. Like that wasn't illogical. There were some small studies suggesting, hey, maybe this isn't a good idea, but it was largely based on like progestins, which we all know are that's not progesterone. But at any rate, I just took it as gospel. And again, logically, it made sense to me. Guys don't make a lot of progesterone, nothing in comparison to women. Just leave it alone. It's just really not something that guys need, essentially, right? And it wasn't until I started digging in a little bit more and learning more that progesterone is one of the most beautiful, amazing hormones out there. Like, it's such an incredible and powerful hormone. And the name itself, progestation, right? I think it just carries with it that it is like, it's for the ladies. And so I think in a lot of ways, God love whoever like discovered progesterone and named it. But I think the name, I don't know, wasn't a good one. I think that it carries this weight and baggage with it, where it was like, oh, progesterone is like clearly for ladies and for progestation and all that kinds of stuff. And it's really so much more than that. Dr. Thierry Hertoff, who I cite often as like one of the guys who really got me into hormone replacement therapy. It was funny because the more I learned about him and the way he kind of proceeded around hormone replacement therapy, there were a lot of things that I don't totally 100% agree with, and that's okay. Like, we don't have to agree on everything. He'd probably say the same to me, but I really liked his approach. He's a very reasonable guy, and a wonderful physician. He had this idea that, progesterone could absolutely be used for guys. In fact, he gave it to a lot of his own male patients, and they had wonderful results from that. And so I remember learning about that and just my brain just kind of melting a little bit, right? Like, well, wait a second. My mentor, who I just spent with, the entire day with, was telling me, don't ever do that. And now this guy's like, oh no, it's totally fine. And like, I give it to my patients and they feel great. And so, it was awkward because, again, with my mentor, I'd see patients with him and we'd talk about hormones, and then, he'd send me in the room, hey, talk to this guy about hormones and stuff like that. And I remember a couple male patients who, in hindsight, I would have absolutely provided progesterone to. And I think because it was so ingrained, I had so much cognitive bias against it that I couldn't see through my own, beliefs or ideas. Like, it was like dogmatic almost, or doctrinal, like, don't do that, don't discuss it. And these were guys who really probably had some really severe PTSD, had been in some really hairy situations in their life, had a lot of anxiety, a lot of, tension, right? You could, those patients when they walk through the door and you're just like, ooh, like, I feel the tension coming from them. Like, it's like their shoulders are really high and they can't relax and they're tapping, and just like, you can just feel that kind of nervous energy. Well, they were tense. They were really tense. When you kind of explored a little bit more with them, they were having trouble sleeping, and they weren't getting enough adequate rest, because of that. And then they were suffering from, a whole host of other problems when it came to their sexual life, right? Like they had a lot of ideas of inadequacy. Let's call it that, right? Like as if it was a psychosocial thing, right? Like they couldn't relax. They were always so like fight or flight that they couldn't just relax and enjoy the moment. And then they would get nervous that they wouldn't be able to perform. And right, erectile dysfunction comes up, and right, it just created this huge mountain out of a molehill thing. I even remember one of the guys, and this was why I kicked myself so many years later. Thinking back at that time, like, gosh, I wish I would have provided progesterone. He had a little bit of like BPH, and, that was really frustrating. And, he had tried the tadalafil and things of that nature, which helped a little bit. But, still had a little bit of, dribbling or difficulty, starting a stream kind of thing. That's difficult as a guy, right? It's embarrassing and annoying and all that kinds of stuff. So anyways, what I'm describing to you is a guy who likely would have done really well with just a little bit of progesterone. Because if you understand progesterone, if you really, really dig into the literature and realize what it is, progesterone is just such a profound hormone. Now, granted, it absolutely has very different, uses and reactions when it comes to male and female. Like, obviously, we're very different. I am also not saying you should give like female levels of progesterone to men. I don't think that's generally a good idea. But what I have found is that very small doses of progesterone can be really beneficial to guys. But again, what I'm really trying to explore here is this idea that I was afraid of being wrong. I was afraid of being wrong. I was afraid of making myself out to be a fool, of making myself out to be incompetent, right? Because that matters a lot, right? If we can't feel competent or like we're the expert all the time and the master at this or that, our ego gets wrapped up in this stuff. It does, whether we like it or not. Like it just happens. And I think it's profound for us as medical providers, as things change, as times change, as you learn and grow. We have to be able to feel comfortable saying like, hey, you know what? I was totally wrong about this. And again, I think what we assume is that patients or friends or family, they're going to be like, oh, you idiot, Nico. Like, how could you have thought that? And like, or it's like, well, what the heck? Like, which is it? Are you ever right about anything? You're always changing your mind. And that's clearly not true, guys. I think we have these inflated ideas of ourselves, first of all. Like, trust me, people don't think about you that much. Not in a bad way, just like, people think about themselves a lot. And so again, we have these inflated ideas of ourselves as human beings. And furthermore, when we're having this discussion in our heads of like, well, should I say something or should I not, or should I just like deny that? What you're really doing is denying someone across from you better care, right? That's what we're in this for. I mean, think about it this way. If you're a surgeon, right? I like to make this analogy. And by the way, I'm not a surgeon, so like this, I could be like way off, but back in the day when someone was doing an appendectomy, we would like cut them open stem to stern, like, right? Like open their whole abdominal cavity, fish around, find the appendix, take it out, suture them up. And like, man, what an invasive procedure that used to be. Because back in the day, we didn't even really have a good idea of like, right, exactly where the appendix was. So look, over time, things develop and we learn and grow more and more and more. And now, that's basically a laparoscopic procedure, right? 2 little incisions or so, nothing crazy, steri strips afterwards. We're good to go. Incredible that we're able to do that. But what if you were a surgeon and you were just like staunch in your ways and you were like, screw these new ideas and screw these new things. Like, I know what I'm doing. My recovery rates are good. Poo-poo to laparoscopic stuff. And even if we show data like, hey, dude, like, I know you think that, but like the data is actually clear that laparoscopic is really good and like our outcomes are better, even if they're just marginal. Okay. Even if it's like 1% better, don't we want to provide the best care to our patients? Like, aren't we trying to provide the best outcomes, the safest things? Like, wouldn't you rather tell your patients like, hey, you know how I did that surgery on you this way? Well, guess what? I'm going to do it this way now for other people because I just found out that it's actually better to do it this way. And I'm so glad to have learned this, right? Like, I don't think any patient's going to be like, oh, well, screw you for giving me the bad. You didn't know. It's okay. Like you didn't know. We all of us are in that same boat. Okay. It doesn't matter what career or job you have, even as parents, right? We make mistakes. And not even mistakes. We do things out of ignorance. And ignorance not in a bad way, like shame on you. Ignorance as in like, I don't know. I never heard that before. Okay. Like you can't fault a provider for doing 200 milligrams ml once every 2 weeks of testosterone cypionate if they don't know any better. And maybe they truly don't know where to look, right? They were brought up through, some crappy, med school or NP school or PA school or whatever, and they didn't even get 1 second to learn about testosterone replacement therapy or even if it was good for people. Like, do you see what I'm saying? Like, we have to have some grace and forgiveness with each other and with ourselves when we just don't know. Okay. But here's the difference. When you are presented information and information that is true and bound by, a good amount of not just consensus, but like factual evidence, right? And then also, how does that actually play out in the real world, right? There's like the kind of three pieces to that puzzle. If all three of those things are fitting together really nicely, well, you know what? We should probably take heed to that and say, I might be wrong. The way I was doing things or talking about things or educating about things maybe was incorrect. And that's okay. Guys, we don't own these things. Okay. Nico Misleh does not own hormone replacement therapy. Okay. It's not my ideas. Like I'm pulling these from the literature, from researchers, from scientists, from other providers throughout the ages, right? We're all literally standing on the shoulders of giants. And so you have to, again, give yourself some grace. If something comes out and it kind of shocks you and you're like, oh my gosh, I've been telling people it was, better to do it this way. And now the literature is saying to do it that way. A bad provider stands firm on that and says, nah, I'm not going to, even though I know that it's better, I'm going to stand my ground because I'm too embarrassed to say I was wrong. Okay. I'll tell you, again, progesterone for guys. I used to tell guys like, oh, you don't need that. And I was totally wrong about that. The more I looked into it, the more literature I read, the more I learned from other people. I was like, I'm wrong about that. I'm totally wrong. And there were actually a couple of my own patients who I had tried a bunch of different things with. And I finally gave this gentleman progesterone. And man, that was really helpful for him. It really was. Of all the things that I had tried, that just seemed to be the winning ticket for him. Oral estradiol is another one, right? And again, there's a lot of controversy around that. Is it okay? Is it safe? Does it cause clots? Is it okay for the liver? Blah, 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 blah. Like, look, I'm hanging my hat on the literature that I've read, which I find to be unbelievably excellent. I hang my hat on all the, of course, experience of my predecessors and people before me who have proven time and time again that it is safe and it doesn't increase your risk of clots. And if you guys are like, what? That's crazy. Oral estradiol doesn't increase your risk of clots. It really doesn't. Seriously. I have all those studies in HRT University too to back that up. I've even written emails about it. But again, I was one of those people like early on, like, I don't know if that's a good idea. Like topical estradiol, I think is a really good idea and safer and better and whatever. And by the way, I'm not disparaging topical estradiol either here because it does work and it can be great. But actually, I think oral estradiol has a little bit of extra oomph to it. At least, again, from what I can understand from the literature. But look, I'm serious, and I mean this, and I'm going to have you guys hold me to it. If tomorrow there was a huge randomized control trial or a really, really huge, observational study done or something on oral estradiol, and it is in fact a lot more dangerous than we thought, or actually it just does not outperform different other methods of administration of estradiol, sign me up. Like I'm going to hop over. I mean that. I really mean that. You know why? Because I would hope that I'm the type of person and provider who could say, hey, you know what? I don't have a dog in this fight in the sense of like, I have to be right. I just want to do right by my patients, and I want to do right by you, right? Like I don't want to tell people things that just are blatantly not true, or stand firm in the ground of like, well, I'm not gonna budge on this, even though it hurts my feelings or whatever. Like that's silly, guys. It's so silly. I always talk about bubbles right? We exist in our own little bubbles. And again, we have these very inflated ideas of ourselves and, what's right and what's wrong and all these different things. And, I think that, I think that it is wise to just take a moment and consider all the things you've been wrong about in your life, right? And also all the things you've been right about in your life. And I'll bet you it's like 50-50. Okay. Like that's okay. That's pretty normal. So let's not let our own, again, cognitive biases or judgments or even ignorance get in the way of great patient care. Right? That is what we're here for. At the end of the day, we are here to help provide healing and wellness to our patients. We are here to also pass down really good knowledge and education to our young ones who are coming up through the ranks of the healthcare world. Like that's on us. And what I find so refreshing, really, especially in the HRT University community, is this new sense of peer-to-peer relationships, a new sense of like, let's provide people grace. You know what I mean? Like, let's provide people a little bit more grace when it comes to, learning about hormone replacement therapy for the first time. And maybe they're doing something that is just kind of wacky or whatever. And we're like, oh my gosh, that's not how you do it. But come on, we were all there before. We've all been in a place where we didn't know what we were doing and it was kind of awkward and we're trying to make it through. And everybody's like, go get more experience. And you're like, I'm trying. That's what I'm doing. I'm trying to help people with hormones. And that's sometimes the only way I can get experience is just by doing. Don't fault people for that, guys. Don't do that. Okay. We're all here for a reason. And I think we're here to help each other. I really do. Every single minute of the day, I'm so thankful for all of you, amazing colleagues that I get to meet and greet and shake hands with sometimes. And have video calls with and stuff. Like it's really incredible. So again, I'm gonna end on this, but I just want you guys to consider this idea. Okay, consider that we don't own these ideas, right? We're not we don't own our thoughts, so to speak, right? This is not who you are. Okay, you are not testosterone, you are not progesterone, oral or sublingual. Like you are none of those things. You are an amazing person and an amazing provider. And the goal is always, can I provide better outcomes for my patients? And can I provide better education for those people climbing the ranks? And can I potentially even admit if I'm wrong and be okay with that and have peace with that versus like shame or guilt? Have peace with it. Have peace, because that's what we really want at the end of the day is peace in our lives, right? That's feeling of calm and I think you're all amazing and I think you're so incredible. And I literally pray for you guys every day. I want you to have that peace in your lives. So provide that for others. Okay. Provide them with grace, provide them with a little bit of healthy, measured responses. And if you're just having a bad day, the scene in Bambi where it's like, if you don't have anything nice to say, don't say nothing at all. That's what I want us to practice. Okay. If you're having a bad day, don't take it out on certainly on social media. That's one of the worst ways to do it. We wouldn't want that to be done to us. And so don't do that to other people. Okay. I know I probably sound like a parent here. I'm sorry. I can't help it. I love being a dad, but I love you all very much. And thank you for listening. I hope this is a sweet little podcast today and a little episode to remind you that you're amazing and the effort that you're putting forth is incredible. And don't be afraid to own up to things and take accountability or whatever. But more importantly, just learn and grow. That's what matters here. Okay. By the way, if you want to learn how to like if you're like, whoa, Nico, wait a second, progesterone for dudes, like tell me more, or how do I learn more? Or how do I do that? HRT University. Okay. HRTuniversity.com. Check out the master course. It's in our adjunct hormone module. It's a really good module. Like a lot of people, I don't think they even get to it sometimes because they're so busy getting into the male and female stuff, which is awesome. But there's some really good nuggets in there. And I have a little section on male progesterone, like how and why would we provide progesterone to men? How would we do it? For what reasons? And it could be really helpful for especially those patients who need it. So thank you guys very much. Don't forget to check out nicomisslehnp.com if you want to join Nico's daily email, where I write an email again, Monday through Friday. No chat GPT, just me writing to you all. helping educate even on things like progesterone for men, sharing some things that I learn and am growing around. So it's a good way to get exposed to those sorts of things. And then, of course, our wonderful Facebook group, which is free, just a place to, again, check out and learn more about HRT University. It's Nico's HRT University. If you just search that on Facebook, you'll find it. Thank you so much, guys. And I'll see you at the next episode.